when she sat up in bed, she said it was serious, call an ambulance. At that point, some of the speech was a little different, and I could tell in her body movements that it looked like a stroke. I might have lost my wife.
Deborah is a young woman in her early 40s. She had no risk factors for a stroke. When I first saw Deborah, she was awake and alert and could speak, and she knew where she was at. Her speech was very difficult to understand, and her left side didn't work at all, and she had abnormal eye movements. So those things together told me that she had a very serious stroke going on.
This stroke could have left her paralyzed, could have had her in a locked-in syndrome, locked in her own body, just laying there knowing, can't talk to anybody, can't move any of her extremities. She potentially could have died from this. That's the biggest fear is, okay, we've got a posterior circulation stroke coming in. What can we do to make this better for this patient?
We knew that we had to move and move fast and try to do something to either remove the clot or dissolve the clot. So Dr. Getzoff was called in to do a catheter presentation of some medication to the clot to dissolve it. She went to having a lot of difficulty with her vision, double vision, slurred speech, total paralysis of the left side. And by the time the procedure was over, which took about a half hour, she was moving the left side fully.
I was in the suite with her, and somebody said, "Oh, I think her speech is a little bit clear." And then I said, "Is she moving her left arm and leg?" So I went in there with them, and Dr. Getzoff had stopped. And I said, "Deb, can you move your arm and leg?" She squeezed her arm, and she lifted her left leg off the table. When she rolled out of the lab, I said, "Deborah, wave at your family with your left arm." And I mean, just to see their smile and just seeing that, and then just the physicians were just smiling, going, "We are doing a good job here."
The foundation is very supportive of our stroke program because our stroke program touches such a variety of different departments. As those departments see needs that they think would be helpful to enhance or help this patient who has suffered from a stroke or their family, they may come to the foundation and ask for support, and we will do whatever we can to support their specific need.
Well, I think it's amazing that in a community hospital we're able to provide such cutting-edge technology. So I think it's unique, and it allows us to provide state-of-the-art care in a rapid fashion. And for brain, that's the whole story. Cells are dying literally by the minute.
The foundation purchased 6 laptops, which equips all of our ambulances with cellular service. This cellular service enables the ambulance and the paramedics to get to the homes of the callers most quickly. The ambulance, the way I view it, is we're actually taking the hospital to the patient.
When they get on the scene, they can do a quick neurologic evaluation, make a determination that a stroke has occurred, and the timing or onset of the stroke. They can give us some heads-up notification before the patient is brought to the emergency department, and then we can mobilize some resources and initiate some interventions that have been shown to be helpful in reversing the devastating effects of stroke.
You can see them recover, and you see them walk out of the hospital.
This is really enheartening. It's a really good thing to see after spending so many years seeing patients have horrible strokes and working with them, for weeks and months to try to get them slowly better. Now we're seeing this dramatic improvement within minutes.
And that's really the reward you get and the community gets for supporting a program like this.
My best part about my job is being a part of the stroke team. Being there when that patient comes in and then get to watch them through all the phases.
We feel proud that we're the first and only certified stroke center in Missouri.
It's funny because I've told my kids if something ever happens to me again or happens to my husband, Boone Hospital is where we want to go. It means a lot. I have 3 kids and 2 granddaughters. That's one of the things I worried about, was coming out paralyzed or coming out with some sort of, physical impairment to where I couldn't take care of myself, I couldn't take care of my family. Just the experience here has been great. I still come back for my follow-up visits with Dr. McLaren. And I did hear the doctors many times say that somebody was watching over me. They can't believe how well I'd come out of this. I'm grateful. I just think this place is great.